I kind of, when we were planning this talk, I thought, well, look, I wanted to chat about a few different conditions, and hopefully what I can talk about, if anyone here has got any niggles that they're concerned about, we maybe will touch on some of the things that you might be experiencing at the moment, and hopefully a few tips for specific injuries maybe you've got at the moment, a few niggles, or maybe problems that you may have in the future or have had in the past. So just a few kind of pointers. Can't talk about every condition and every person, but we'll do our best to cover as much as we can. Again, Q&A at the end if there are any sort of specific things that you had an interest in. With triathlon, I'm going to talk really just about the lower limb, because probably 85% of triathlon injuries are lower limb injuries. I'll talk about acute injuries because they're a bit nerve-wracking at this time of year, but we'll also talk about overuse injuries, which are probably the most common injuries that we as triathletes have to deal with. And certainly in the clinic, we spend most of our time either trying to get rid of grotty overuse type problems, or calming down acute flares of a long-going problem, an ongoing problem. So we'll look at acute injuries and overuse injuries as two kind of divergent, different types of injuries, because those two injuries require two fundamentally different ways of managing them. Okay, so if we look at acute injuries, first of all, the thing I just would draw your attention to from the outset, I hope you can see from there, is it's just a very little bit of science on how tissues heal. Okay, when you damage a tissue, when you have any kind of acute damage to a tissue, you get a bleeding phase, and then you get a phase where new tissue, scar tissue, is laid down, and then you get a period of time where that tissue matures and strengthens. All right. Now's not the time to be kind of having a science lesson, but there's very little we can do about this process. And I think the most important thing we can do if we sustain an acute injury, you know, a sprain, or more commonly in triathlon, a muscle strain, we need to respect and recognize that this natural, normal healing process can take place. And probably the biggest thing that we see that's detrimental for athletes is they get in the way of this. Okay, and they get in the way of it normally by trying to do too much too soon. And that's because we're anxious that we don't want to lose fitness and we want to get back going again. And so probably my biggest job in managing these is kind of just helping you guys know that that's fine, that's going to happen, that'll make you better and stronger, but you've got to let it do its job. Okay, I've got a few guidelines that can sort of help us help Mother Nature along the way. So look, muscle strains, calf strains, it's the most common triathlon-related muscle injury or acute injury. So look, we could talk about quad strains and hamstring strains and other lower limb muscle strains, but overwhelmingly, I'd probably say 90% of these injuries would be calf muscle strains. And I'm sure there's plenty in this room that have either had an acute calf strain or an ongoing niggly strain. What I would say is that if you feel that when you run, you get this sense of a tight calf, either from time to time when you're fatigued or from time to time when you're kind of ramping up your training, it's probably a precursor to getting a strain. Okay, it won't definitely happen, and it doesn't always happen, but it often does. Okay, and I would say it's a kind of early manifestation of what this strain can be. So why do people strain their calves? What are the risk factors for that? Okay, the biggest underlying feature is a weakness in the muscles. Okay, and that's something which is obvious to see, and you need that strength within that muscular unit to be able to propel you for the kilometers that you're running. Okay. The second thing is overuse, and a quick comment on overuse. Overuse is a relative thing, okay? So whether you're running 10 or 15 kilometers a week, or whether you're running 90 or 100 kilometers a week, that sense of overuse is a real relative thing. And the important thing is that your increase in load, and this is a training principle, needs to be slow, gradual, and linear, okay? Very rarely would I see someone come to me and say, look, I've pinged my calf, and if I say, look, what's your running history in the last few weeks and months? Very rarely would I see someone say, well, I was running 50 kilometres last month and 51 kilometres this month, 52 kilometres this month. Now look, that's a bit of a facetious way of putting at it, but the other extreme is what we see. We see this, oh, well, I did nothing for a few weeks and then I was behind on my training, so I went up and then I got a niggle and then something else happened and I went down and then I was back up. And we see this yo-yo. Okay, so if that rings any bells, then it's an important thing to note from prevention especially. The other really important thing is dehydration, and I reckon round about this time of year, we're in a real tricky situation because it's hot, and people are starting to ramp themselves up for say the 70.3 in May, and chronic dehydration is a big problem with runners. And I think very rarely would I see someone and they say, I've pinged my calf, and say, oh, how have your hydration levels been over the last few days? Very commonly there'll be a report of, oh yeah, I did my long run and it was really hot and I probably was too busy to rehydrate properly in the 24 to 48 hours afterwards. So that's something that I think you probably should be aware of. These are things that we can do something about from a proactive perspective, and Merv will talk a lot more about that in a moment.